Hello, good afternoon. My name is Latoya Brown, and I am one of the health and social care lecturers and course leader on the health and social care course, level one and level two, level three. Today, we're going to have our virtual webinar, but before we go into our presentation, we're just going to wait for a few minutes, just for a minute, for others to join us. Before we go into our session, we will have testimonials from two of our students from Health and Social Care departments. And then after that's completed, we'll go right into our presentation.
And I thought, oh, I'm not going to make any friends and I'm going to spend my lunchtimes alone and just, struggle. But when I actually went there was a culture, like a diverse culture within the college community. So you have a lot of people to look to, a lot of people that help you as well. They come out their way to help you, even if you don't know them. So I think the one thing I would tell someone that's coming into college is don't be afraid to ask help when you need it, and you should feel free to talk to any of the members of staff whenever you need help.
I've made some good friends. One in particular, I work with her at the hospital as well. So yeah, I've met some really lovely people.
There's a lot of opportunities that come along with the course. So I've been put a placement at UCLH for the past 2 years, and over the time I've been working in the rollout of the vaccine. I was the first volunteer to get vaccinated as well, and that was all because of the opportunity that the work placement team at college provided. So overall, the college course, it's wonderful as well. The teachers are really helpful and supportive as well. So you can go to them at any time when you have questions and if you need help. And especially because of how remote learning has been for everyone. So it's like a mixture of emotions for everyone. And they're still there to help you and support you throughout all your assignments.
It's much more independent based. So it's a good stepping stone from school to uni because it's like just middle ground, I think. They give us deadlines that are possible to achieve, and it's good because you can sort of divide the workload and just work at your own pace most of the time.
That's something I really value, especially from coming to the college. I always talk about this as I come home with my mum. This is something we both realised because she was at Barnet and Southgate at one point as well, doing a part-time course. So we definitely learned that they go out their extra way just to help us when they really need to. I definitely did not receive that when I was at school, sixth form or fifth form. I had to find out my own work experience. I had to be I had to do things on my own. I didn't get that support when I needed it to be there. But with college, they've helped me. They've kind of they've helped me forge a path forward. So they've opened up different kind of routes into different things that I want to try, whether it's being student representative or whether it's trying out a new work experience. So they've all helped me be a part of that. That is one of the biggest differences because you don't really see that in school teachers, and the college teacher is a bit more attentive towards you and your concerns at the end of the day.
But the freedom so much better. I did try going to sixth form for a month and it's just so different. At sixth form they still treat you like you're like a child still. You're not allowed to go out whenever you want. In college you're treated like a much more of an individual, and it's just a very different feeling. There's all the shops around, so you could go out for if you wanted to splurge, you could go out for like takeout, or you could go to Tesco's and the Starbucks in the actual college. It's good.
If I had to be completely honest, there was a time where I felt like the workload was a lot because I felt like I committed to a lot than I could actually handle. But I think it's just because I was trying to be student representative and then volunteer at the same time. And it was a very hectic time, especially when you had to manage to remote learning and trying to do your assignments that way. But I think the key to all of, my success would be time management and trying to plan ahead and definitely having some kind of coping strategies. So even if that's just talking to someone or listening to music and managing your time effectively, that would help you cope with remote learning and managing all your duties and responsibilities.
Describe it as a really good environment for learning and growing as an individual and meeting people from all backgrounds. It's just a really good experience.
especially with how the society is now, students need to be able to study in a safe environment. And I think Wood Street campus especially has provided that for me because of the facilities. You have a lot of transport, you have a lot of shops and varieties of resources outside just surrounding college itself to help you. So I think in that perspective, it's really important for students to make sure they're studying in a safe environment, as well as being in a college community that's going to support you in and out of college.
Okay, so we start over. So welcome to our department again, Health and Social Care Department. I'm going to be looking at level 1 programs, level 2, level 3, and or access programs in my presentation. First of all, our department, we have quite a lot of skilled, experienced staff who have worked within health and social care settings, as well as we have our qualified teachers. And we also have lecturers who've also been professional social workers, work in the nursing profession, as well as health and social care profession. So first, we're going to look at what our curriculum has to offer. And at the end of my presentation, I will also have a page up for you to see the contact details for myself and other course leaders, and also our curriculum leader. Please feel free to send us any emails regarding questions you have about the course if your question is not answered today. And we will aim to get back to you as soon as possible. Okay, so in this department, we have health and social care. We've got access to nursing courses. Also, we have access to social work course as well. Now, the access courses are higher education. Well, they are pathways to higher education. So for those of you who are looking to go into nursing or into social work, and do not have the qualifications required to get to university at the moment, completing one of the access courses with us is a pathway into higher education. Okay, so first let's begin with our full-time programs for our level 1s to level 3. Now these programs are for 16 to 18 years old. And we do have a lot of mandatory units that we cover. Also, we have optional units that we also have included in the programs. And specialist units, such as in our level 3 program, we have specialist units such as complementary therapies, sociological perspectives, psychological perspectives as well. And we also require that all our students complete a DBS, which is funded by the college. This is a requirement because of the course that you are doing. You will be working with those who are vulnerable. You may be working with children or adults who are considered vulnerable. Therefore, it is a requirement that everyone must complete a DBS check. As I said, this is funded by the college. We just need you to bring your documents in so that we can complete the check for you. Now, when you are enrolling or when you come for your interview, we will also have that conversation with you about DBS, and we will also make you aware of what is required for us to complete a DBS check and for you to get your certificate back so you can go out and do your placement. We have a placement team who coordinates all your placements. They look for placement opportunities with you. We do work quite closely with local charities, as well as we work with the Barnet Hospital and UCLH as well. So some of our students do their placements at UCLH. We have quite a lot of students because we work in partnership with Barnet General Hospital. We have quite a lot of students who also do their placements in Barnet Hospital and also other charities such as Sense, Mind, and so on. Okay, for the level 1 program, there are, for your entry requirements for the level 1 program, there are no entry requirements really for the level 1 program. We just need to know that you have an interest within health and social care. But for the level 2 program, you do need to have your GCSE Maths or English, along with 2 other GCSE subjects. So in total, 3 GCSEs. So you may have Maths or English, but you're not required to have both. Your GCSE grades must be above a grade 4 or above, or equivalent, and your equivalent would be a level 2 in functional skills, Maths or English. Sorry about that. You can complete your Maths and English with us. But you will be maybe required to sit a task, complete a task for Maths and English. So they can gauge what level you are studying at or what level you are at the moment. Some of you may be able to enroll onto the functional skills course depending on your level, and some of you may be able to go forward for the GCSE Maths or English exam if you don't have the subject right now. You may be required to complete a written task so we can see what your level of English is if you do not have English language GCSE or a level 2 in functional skills. If you do have a level 1, health and social care certificate or qualification, then you will be able to enroll onto the level 2 health and social care course. But we still would need you to have at least Maths or English GCSE before you can enroll onto the level 2 course. Now moving on to level 3. To get into the level 3 course, you will need to have 5 GCSE passes, and that would be from a grade 4 above. So for level 3 year 1, the level 3 program is a 2-year program. Level 3 year 1 will be consisted of 9 units that each student will complete, and this is for the 16 to 18-year-old group. And that will also include, you will also have a synoptic exam, which is an externally set exam. This is set by the CASH, the awarding body. And you will be sitting this exam, which is normally taken in about February. And so that exam will be marked and set by CASH. So with that, plus your 9 units, that will be a total of 10 units that's completed for your year 1 program. Year 2, you will complete 9, which will be, you'll complete 10 units, which will be 8 units completed with us in the classroom, 2 exams, one which will be your synoptic exam and one will be your biology exam. Now your biology exam is normally in January, so therefore you will be preparing for that. You'll start preparation from year 1 in June year 1, but your classes for biology will begin September in year 2. So you start preparing for your biology exam, and then your exam will be in January of the following year. For the level 3 program, you must have 5 GCSEs. You must have English and Maths to get on to level 3 year 1. If you do not have Maths and English, then the possibility will be you'll be looking at going on to the level 2 program, and so you will be able to sit your Maths or English on level 2 and then progress on to level 3. If you do have a level 2 qualification, along with Maths and English, then you will be considered for the level 3 program. But if you don't have maths and English, then you will not be considered for the level 3 program. So it's very important that you do have maths and English. We also would, it's not a requirement, but it would be, we would also like our students to have some knowledge of a science subject before you begin the course. So it would be a good, it would be good if you have a science subject that you've taken in GCSE as well, but it's not a requirement. We also have the level 2 matures, which is also a cash qualification. To get onto the level 2 matures course, you will need to have a level 1 in functional skills English. You're not required to have maths, but you must have at least a level 1 qualification in functional skills English. If you do have GCSEs, that's a plus, but you must be able to show that you have a good understanding of the English language to complete level 2. The level 2 matures, you will also be required to find yourself a placement. So if you are working within the field of health and social care or within a field similar, then definitely you can use those hours towards your placement. But if you're not working within health and social care, you are required to find a placement so you will be able to get onto the course, For our level 3 access courses, to get into access to nursing, maths and English at grade 4 or above is also required. Again, an equivalent to this will be considered. So if you have a level 2 in functional skills, maths and English, then that will be considered for the access to nursing course. You're not required to have a certain amount of GCSE passes. As long as you do have maths and English to get on, you'll be able to apply for the course for access to nursing. The person that is in charge of access to nursing is Richard Chisman. He is the course lead for access to nursing, and his details will also be available on the final slide of this presentation. So if you have any queries, any questions, please email Richard Chisman for information about access to nursing or access to social work. He's also the course lead for access to social work. Okay, so on the successful completion of the interview, you also will be interviewed for your access to nursing course. You may be asked to complete a written task as well, so we can look at what your level of English is. We can assess that. It is also a plus if you have experience in health and social care settings. This is desirable, but not a requirement. But definitely would make your application stronger if you had experience within this area. Okay, so now we have access to social work. For access to social work, you are not required to have maths, but you are required to have English at a grade 4 or equivalent, which is your level 2 functional skills. This also requires you to have a successful completion of an interview, and also you may be asked to do a written task to assess your level of English and writing skills. It is desirable if you had experience in a health and social care setting, but it's not a requirement. So these access courses, access to social work and access to nursing, these are pathways into higher education. So during your time with us, we will provide support with applying for university, We will provide support with writing your CVs and also writing your statements for university as well. We do have workshops for students with our careers department, that you have workshops where we have helps. You can have one-to-one support, or you can have, and we also do classes where you do group workshops and you get support with applying for university and also completing your university applications. Right. So for all our courses, when you enroll, you get access to a Microsoft package. This is for free. So you have access to PowerPoints, Word documents, OneDrive, Office 365. And most of my students, they download this on their mobile phones. So they have access to that on their phones. Also, they download it on their devices. So you've got a laptop or your desktop at home, you can download the Office 365 and have access to Microsoft Word for free, as long as you're with us with the college. So to support our students to complete assignments, because all assignments are submitted online. So therefore, we students will need access to Microsoft Word, PowerPoint, and so on, and OneDrive. So therefore, the college provides this for you for free. Because we have the because of the pandemic at the moment, delivery is a mixture of face-to-face and online at the moment, but we will be reassessing that and looking at how we will be delivering our courses in September. It may be that we'll continue with a mixed method. However, it could also be in the classroom face-to-face only. So that will be reassessed and you will know more in your enrollments or interviews. Okay, and these are the contact details for Charlotte Peterwood, who is the curriculum manager for the Health and Social Care Department, as well as Education and Care, the Child Care Department. Myself, Latoya Brown, I'm the course leader for the Level 3 and Level 3 Year 1 and 2 programs. And Access to Nursing is Richard Chisman. He is the course leader for the Access to Social Work and Access to Nursing programs. He also teaches on the Level 2 program as well, Level 2 program for 16 to 18-year-olds. Okay, if you do have any questions, I'm going to leave this slide up so you can see the contact details. But if you do have any questions, please feel free to write them in the Q&A section and I will be addressing them. Thank you. Okay, question here from Faranaz. So question is, hi, this is Faranaz. I'm interested in nursing course and I have a level 2 of English and maths. Could you please help me, if possible, to get a level 1 of nursing? Okay, the nursing courses that we offer here at Barnet Southgate College, it's a level 3 nursing, access to nursing course. So we don't do level 1 nursing. Okay, we do level 3. But if you do, as you said, you've got maths and English at level 2, if this is a level 2 functional skills, maths and English, and not entry level to maths and English, then you will be able to apply, and we will look at your application and take that into consideration. So if this is a level 2 functional skills, maths and English, that is fine. You can go ahead and apply for the access to nursing. Okay, so looking at Eva's question, Eva is asking about placement for the level 2 and level 3 courses. Eva, if you are a 16 to 18-year-old student, your placement is coordinated by our placement team. So they will find your placement for you. In regards to choosing the time that you attend, once you receive your timetable and you know the days your classes are on, then the days that are free, those are the days you normally go out to do your placement. So it will depend on your timetable. Okay, so just an example, if you had classes on Monday, Wednesday, and Friday, that means you have Tuesday and Thursday free, which will be your placement days. Okay. Is this course different to BTEC? I did not get the name. Okay, Muna, is this course different to BTEC? This course is very similar to BTEC. At the end of this course, your qualification is equivalent to 3 A levels. So you can use this qualification and apply to university to do the course that you want to do. And that's from Muna's question. Are there any part-time courses for level 2, level 3? For 16 to 18-year-olds, these are not part-time courses. They are full-time courses. The level 2 mature, I'm not sure if you're asking about mature or 16 to 18, but for the level 2 mature, that they attend, I think, once or twice a week. So that would be more part-time. But for your 16 to 18-year-olds program of studies, they are all full-time. For the access courses, they are full-time. Muna, okay, Muna's got a question. What are all the units in the level 3 extended diploma? Muna, this is over 2 years. Okay, this is over 2 years. So you've got year 1, which is your certificate program, and year 2 is your extended diploma program. So combined, they are 3 A levels, equivalent to 3 A levels. So some of the courses on year 1 will be sociological perspectives, psychological perspectives, equality and diversity, safeguarding, communication, working in health and social care, reflective practice, and so on. Infection prevention and control in health and social care. On our level year 2, on year 2 of the level 3 program, you are completing courses such as protection of children, young people, and adults, empowerment in health and social care, research skills, personal and professional development, ethics in health and social care, um, complementary therapies, and alternative medicines. Those are some of the courses, the units that you will be covering. And also you are covering biology and your synoptic, which are um, external exams. No, this is for Nicola. I know the social work course is full time. Do you know what the hours will be? No, Nicola, I do not know what the hours will be. I cannot say what it will be right now because the timetable gets published. A different timetable gets published every year. So I cannot tell you what the times will be like. Okay, so Barrows. Barrows is asking, when are the interviews for access to social work starting? Okay, Barrows, we've already started. We will be starting, I think, in next week. So it is, I will say currently, we've already started and it's going to be in full swing by next week. We will be doing interviews and so on. So if you have applied, you will get contacted soon. Maria, could you give us an idea of what the access to nursing timetable looks like? Maria, I can only say um, what they did this year. I cannot really tell you what's going to happen in September. So this year they had classes on Wednesday, Thursday, and Friday. So no classes was on Monday and Tuesday this year. They had it Wednesday, Thursday, and Friday. But this is subject to change with the new academic year. Where should I look for placements? Is that Ismatho? You're 19. What course do you want to study? Now that would be important as well. What course are you looking to study? But if you're looking for placement, it would more likely be in settings such as care settings, any care settings, or some of our students have worked in nursery settings as well. So care settings, nursery settings, anything that's related to care. Charities as well. You work with charities. Okay, Xavier, I hope I'm pronouncing that right. Xavier, your question is about your qualification that you currently have in law, level 3. Can you apply for nursing? Okay, do you have maths and English? That is a question. You must have maths and English to apply for the nursing course. Okay. Natasha Brown, do you have learning support for maths? Yes. So if you need any support with your studies, you can apply for one-to-one sessions with with the library, we do have a learning support team that will help you if you book one-to-one sessions with them. Okay, so each lecturer or facilitator has their speciality, so you will be able to get access to that if you book one-to-one sessions. You'll get some support with that. Okay, Cassandra, you want to know about your current qualifications from the Philippines, and how you can where can I submit my credentials? Okay, Cassandra, in regards to your current qualifications, you would have to get those in NARIT. You can also, or Learning Resource Center can help you with that. So when you do come in, we will direct you to where you need to be, and they will help you to get your qualifications NARIT to see if they are equivalent to GCSEs here in the UK. I hope that answers your questions. Cassandra, which course is suitable for me? I'm 17 years old and turning 18 in December. Okay, Cassandra, you can go on to the level 3 program, but it also depends on your qualifications, your current qualifications. Do you have maths and English? If you do have maths and English, then it must be grade 4 and above. And also you must have 3 other subjects, GCSE subjects, to go along with your maths and English for the level 3 program, level 3 health and social care program. If you don't have maths and English, or if you don't have maths but you have English, or vice versa, if you have English and not maths, then you'd have to go on to the level 2 program. Okay, so it also depends on the qualification you have. For the level 3 health and social care course, okay, Samora, on the level 3 health and social care course, do they help you find work placement, or do you need to find one yourself? If you are on the level 3 course and you are, or 16 to 18 students, yes, we do find a placement for you. Okay. Just looking if you've got any more questions. Yes, Eva, your question is there a placement for level 2 and also for the level 3 course? Also, I am able to choose where I go for placement. Okay, I think I answered that question already. So yes, there is a placement for level 2 and level 3. For the work placement, is NHS Bank okay? So that's a question from Samora. Yes, that's okay. Okay, you're interested, is Xavier interested? Hi, I'm sorry. I'm interested to start a nurse course. I will need more information. Okay, for the nursing course, Xavier, you will need to have maths and English at a level 2 functional skills or grade 4 and above in GCSE. If you also have some experience within health and social care, within a health and social care setting, then that is desirable, but it's not a requirement. So you do need to have maths and English. Can I do maths alongside the level 3 course? That's from Muna. Muna, for the level 3 course, if this is the level 3 health and social care course, no, you would not be able to do maths alongside the level 3 course. If you want to do maths, you would have to start from level 2. The level 3 is quite intense, so we don't recommend that you do maths alongside your level 3 course because you have quite a lot of coursework to do. So you would need to do that with your level 2. Hello, in part-time courses for adults, this is Calliope. In part-time courses for adults are maths and English and healthcare all on the same day. It will sometimes it depends again, this depends on the timetable. Okay, sometimes you have maths. It may be that you have maths in the morning and you might have the rest of your classes in the afternoon. It does depend on your timetable. Or sometimes it could be that your maths class is on a separate day. So I cannot really give you a definite answer for that, Calliope. Okay, Aziza wants to know about her qualification. So I have a qualification in GCSE in English and Maths. Does that mean I can enroll to access to nursing or access to health and social care? We don't have access to health and social care. We do have a level 3 health and social care. So if you are a mature student, meaning you are over 18, then you would be able to go onto the access course with your maths and English. And if it is that you want to do access to nursing and you're over 18, yes, you can apply for the access course in nursing. If you are between the ages of 16 to 18, then the level 3 course would be the one that you'd apply for and not the access course. But if you have maths and English alongside 3 other GCSE subjects, then definitely you'd be applying for the Health and Social Care Level 3 course. What's Halima? What is the benefit of studying health and social care? Okay, Halima. If you are interested in working in healthcare or social care sector, then that's the benefit of studying health and social care. If you're interested in working in nursing, social work, interested in doing going on to university to do courses such as psychology, criminology, working as a child nurse, looking at chiropractic, various allied professions as well within healthcare. then this health and social care would be the course for you. If you're looking at working in social care, so working as a social worker, working as in, what should I say, in any allied professions regarding facing the public within social care, then you can do the health and social care program of study. Okay, I'm not sure if you can see my slide. There should be a slide up, which has all the email addresses. Okay, there's a slide up with all the email addresses. Myself, Latoya Brown, Richard Chisman, who is, if you have any questions regarding social work or access to nursing courses, then please email Richard Chisman. If you have any questions about level 3 programs or level 2 programs, you can email me. My email address is Latoya, that's LATOYA.brown at barnettsouthgate.ac.uk. And you should have a slide up where you can see the contact details. Please take those details down. And also, I do need to end the session now. So thank you so much for all your questions. And please email me if I didn't address your question today. Please email me with your question or any further inquiries that you may have. Thank you so much. We've now come to the end of our session. Thank you for joining us.